Hello, my name is Robert Pollock, and this is the Standardized Patient 2 reflection video. So, overall, I felt the reflection went really well, or the video and the encounter went really well. I kind of knew going in and kind of looked at the case and was like, okay, I think it's something urinary tract or something along those lines. So really kind of that's where my mind was going to begin with, and it just kind of kept going there as the evaluation went on. One of the things that I felt went really well, or that I did really well, was try to find more of a trigger for her symptoms. So, for example, I kept asking, okay, so is there any other times? Is there any other things that you do that you notice this pain? Really trying to get a pattern of when it comes, when it goes, when it's present, how intense it is, so on and so forth. Unfortunately, I don't think we really found a pattern for her pain, but the finding that there wasn't a pattern is also finding the pattern as well. So I thought that went really well. The other thing that I thought went really well was that I began to ask and began to dive into kind of her sexual activity and gaining more confidence asking those questions and losing some of the awkwardness of, okay, how many partners do you have? Do you practice safe sex? So on and so forth. Really kind of an awkward question to ask sometimes, but really thought I'd kind of improved on that and kept going and growing in that regard. So then this kind of goes, we're going to transition into some of the things that I thought went not as well as they could have. The first thing would be temperature. I know I talked to Dr. Gavin after the encounter and said, hey, I didn't see any covers for the temperature probe. I mean, I saw the ones on the wall, but those were removed intentionally, and was trying to use those too, and then was realizing, it really isn't the right cover, so just kind of scratched that. I recorded in my documentation that I would do that next time she comes in, or when we were going to the doctor's office, either one. The other thing is, I think I could have gone a little bit further and kept diving deeper into kind of sexual behavior and sexual activity. I don't believe I asked if she was practicing safe sex. I don't believe I asked how often, how, etc., etc. with that. Kind of what I learned from this is that I can continue to dive a little bit deeper into sexual activity and get more of a full history with their sexual activity and sexual behavior, something that still is a little lacking and need to be more tactful with. And then also just from realizing that the temperature covers were in the med kit really taught me that I should be very familiar with my med kit when I go into the field and start practicing, and also while I'm at West Vigo, really learning that med kit to make sure that what we need for the day is actually in there, and that everything that we need for this game, the next game, so on and so forth is also in that med kit. So my name is Robert Pollock, and that was the Standardized Patient 2 reflection video. Bye-bye.